Coming to the final topic, that is sepsis. First, we need to know the classification and definition of sepsis. What is sepsis? It's a multisystemic syndrome due to infection-related inflammation ranging from mild abnormalities to multi-organ failure and death. So we had the recent update in 2016 that's based on the sepsis 3 definition, but the original sepsis definition is based on SARS definition. So it's evidence of infection with SARS, right? So what is SARS? It's systemic inflammatory response syndrome. So it's an inflammatory response to infection in ischemia or hemorrhage. So because it can occur due to ischemia and hemorrhage also, this is not really good to use in practice. And what is the criteria for SARS? We're going to use temperature, heart rate, respiratory rate, and WBC. Temperature more than 38 or less than 36 degrees Celsius, heart rate more than 90, and respiratory rate more than 20 or equal, and PaCO2 less than 32 millimeters of mercury. Or alternatively, WBC more than 12,000 or less than 4,000, or band forms more than 10%. So out of these four, if you have at least two, you're going to call it as SARS. But this is outdated. As I said, currently we are using the sepsis 3 definition updated in 2016, which is nothing but infection in the presence of a life-threatening organ dysfunction, which is defined as the SOFA score of more than or equal to 2, or we can say change in SOFA score of more than or equal to 2. What is SOFA? It is sequential organ failure assessment score. So we're going to look at the SOFA scores now. So what is basically the SOFA score? So it's going to include certain parameters like the circulatory parameters, like cardiorespiratory parameters like PF ratio. It's going to include the platelets, which is an hematological parameter. It's going to include bilirubin. It's going to include the circulatory parameters like mean arterial pressure or the amount of vasopressors needed to maintain the minimum mean arterial pressure of 70 millimeters of mercury, and the GCS score that's going to tell you systemic sign of inflammation. Yes, fevers due to neoplasia. Yes, they might have systemic sign of inflammation, but not always. And creatinine and urine output can be used as well. So what you're going to use? GCS, then PF ratio for the lungs, then for the circulatory system, you're going to use mean arterial pressure and the amount of vasopressors used to maintain the MAP. Then for liver, it's bilirubin. Then for the kidney, it's creatinine and urine output. Then finally for the blood, it's going to be platelets. So far more than 2 suggests high risk and very high sepsis-related mortality. That's why current definitions are going to use SOFA score and not the SARS criteria. So what do you mean by severe sepsis? If the patient is having sepsis and organ dysfunction along with hypoperfusion or hypotension, we're going to call it as severe sepsis. Examples of severe sepsis can be lactic acidosis, oliguria, AKI, altered mental status. All of them are signs of hypoperfusion, right? So what do you mean by the term septic shock? It's severe sepsis. It's severe sepsis plus if the patient does not respond to fluid resuscitation. We have initially tried resuscitating with fluids of at least 30 ml per kilogram, but if the patient does not respond to fluids, that is what we refer to as septic shock. So let me tell you the definition. Sepsis with persistent hypotension requiring vasopressors to maintain MAP of more than 65, plus if the patient is having serum lactate of more than 2, which is a definitive sign of hypoperfusion, despite volume resuscitation, at least 30 ml per kilogram, right? So that is what we refer to as septic shock. So it's fluid refractory hypotension or failed fluid resuscitation. That's what we refer to as septic shock. So what is the common cause of septic shock? It's going to be because of gram-negative rods. Most of the time, it's going to be gram-negative rods. Gram-positive cocci rarely produce septic shock. Usually, they don't produce. Endotoxic shock, that is gram-negative shock, is the commonest cause. It can be due to pneumonia, UTIs, bloodstream infections like central and associated bloodstream infections, intra-abdominal infections, and so on. Sometimes non-infectious mimics can produce septic shock-like presentation like IBD, especially if it's toxic intubation or MI, pancreatitis, pulmonary embolism, DK, SLE. These things sometimes can mimic a severe sepsis of septic shock, but in most situations, it's going to be quite simple and straightforward. Then we have a newer tool called as the QSOFA score, because the SOFA score can be used only in the ICU settings because it's really difficult to use in emergency. But most of the time, severe sepsis and sepsis has to be diagnosed in the emergency situation, in the ER itself. That's why there has been a QSOFA score. What is QSOFA score? It's going to include only 3 parameters, like respiratory rate, the mental status, and systolic blood pressure. So if the respiratory rate is more than 32, the GCS is less than 14, or the systolic BP is less than or equal to 100, in that if you have at least 2 plus, then you can see high risk of poor outcome. So in these patients, you can consider doing a full SOFA scoring. So advantage of this is the fact that it's going to be a bedside tool for early identification of sepsis and severe sepsis without any additional lab tests. That's a big advantage. It's a quick process. Then we have the newer tool called Phoenix score. Phoenix score is typically used in children. SOFA score for adults, the Phoenix score is predominantly for children. It's going to make use of the parameters like fever, tachycardia, tachypnea, hypotension, leukocytosis, or leukopenia, elevated lactate of more than 2 millimoles per liter, altered mental status, and oliguria defined as urine output of less than half ml per kilogram. So each and everything will get 1 point. And in that, if you have at least 4+ points, you can call it as severe sepsis or septic shock, but it's predominantly going to be useful in children rather than adults. Adults SOFA is going to be the best. And it's a like rapid bedside assessment tool. So it's going to be very helpful, as I said, in children, not in adults though.